Hello, in this video I'm going to be talking about hot flashes. What are they? What causes them? And what can you do short of medication to help yourself if you're going through hot flashes? If you're watching this for somebody else, you may also find some helpful tips that you can share, or you can have them watch this video. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content. And as always, you can go to yerbba.com to get your personalized report. So hot flashes refers to, and sometimes you'll hear them called hot flushes, refers to a feeling of warmth or heat that comes on fairly quickly and can last anywhere from a few moments to up to an hour or even longer. They are associated for many people with chills, with a sense of nausea or even dizziness. Some people may get a sense of anxiousness. Some people can note palpitations where the heart sort of feels like it's fluttering. So if you haven't had these, it's important to know that these can be really disruptive as well as being embarrassing, and some people can get sweaty, and if you're in a meeting or a stressful circumstance and you develop one of these, a lot of people find these are really life-altering. They can also occur in the middle of the night and interrupt sleep. In fact, a lot of work has been done showing that when people wake up at night, they are having what are called vasomotor symptoms or hot flashes, and that we can even have these when we're sleeping and not wake up, yet they still disturb our sleep. Hot flashes can be caused by a variety of things. So they can occur in people without breast cancer, of course, when ovaries aren't working as well, and actually people with functioning ovaries can start to have hot flashes as early as late 30s or early 40s, even when the ovaries still, for all intents and purposes, look like they're working just fine and still making estrogen. Thyroid problems, anxiety can cause hot flashes, and what we call vasomotor instability, which just refers to the way the blood vessels contract and then dilate. That is what we refer to as vasomotor instability. But hot flashes in people who've had breast cancer can be the result of a host of different things. In particular, it's related to estrogen and estrogen in the body. So if there are irregularities in estrogen because the body's going through menopause or because of treatment for breast cancer, this is when you start to see the symptoms. So types of treatment: chemotherapy can cause problems with hot flashes because chemotherapy can affect functioning ovaries. We also know hormonal therapies like tamoxifen and the aromatase inhibitors can cause hot flashes. We see when people have their ovaries suppressed or removed, they can have hot flashes. Again, these are times when hormonal levels are fluctuating throughout the body, in particular the hormone estrogen. There may be other hormones involved in the experience of hot flashes, but the ones we know, the hormone we know the most about is estrogen. Now, if somebody is on the brink of going through menopause and they get put on chemotherapy, and chemotherapy puts them into permanent menopause, this is a really abrupt form of menopause. As I mentioned, we start to go through menopause in our late 30s, early 40s, but if you go through menopause really abruptly, if you go on a medication that lowers estrogen in your body really abruptly or blocks the estrogen receptor, this is different because it's more acute in onset and your body hasn't had a chance to adjust. So I just want to validate that while this is similar to natural menopause, treatment-induced menopause is a little harsher on the body because it's so abrupt. You know, people who have their ovaries removed because they're at high risk of breast and or ovarian cancer go through menopause in just a few minutes, right? If you think about the ovaries were present and now they no longer are. And that can be very hard. You're sort of slammed into menopause. And that's really the same for all of these treatments that can cause it Radiation therapy does not cause problems or changes in the estrogen level unless radiation therapy is given to the pelvis and the ovaries are affected. But in general, surgery and radiation therapy are not known to be associated with changes in hormone levels and thus are not responsible for hot flashes. One thing we know is that stress can bring them on. This is helpful to know because it can be one of the ways you can combat hot flashes. What else can be done? Well, in general, we do not recommend estrogen replacement therapy because even in estrogen receptor negative tumors, there is concern that hormone replacement therapy could increase the risk of recurrence, even with hormone receptor negative or triple negative breast cancers. So in general, hormone replacement therapy is not considered a strategy. And that's really hard because we know that's really effective in helping hot flashes and that can be tapered more slowly than the suddenness of treatment-induced menopause. There are other things that you can do if you're on hormonal therapy. You can stop for a couple weeks and then go back on it at a slower dose, at a slower increase. You can start with half a tablet and then go to a full tablet. So there's some things where stopping and resuming with more of an introduction of the medication can be helpful. There's some evidence that exercise can help us regulate our body's temperature, which hot flashes are basically dysregulation of our body temperature. And some studies also showing that exercise can make things worse. I'd love to hear in the comments what your experience has been with exercise and hot flashes. And then another thing you can do is look at all the other stuff you put in your body and see if you can cut some of that out. So cigarettes are known to be associated with hot flashes. Alcohol, by affecting the way the blood vessels dilate and constrict, is really famous for making hot flashes worse. And it may not be while you're having the alcohol, but in the following weeks. So try tapering down on how much alcohol you drink for lots of reasons, but for hot flashes, it's a really helpful intervention. Caffeine affects the blood vessels. It actually causes dilation or constriction of blood vessels and can lead to some temperature dysregulation. So while caffeine is great because it's alerting and it can give you some short-term energy boost in the morning, if you're struggling with or suffering from hot flashes, try cutting back on the caffeine that you put into your body and see if that helps. Some people say spicy foods can make things worse. And as I mentioned, stressful situations can make people have a hot flash. And anxiety alone, even without hormonal fluctuations, can lead to that flushing feeling and a feeling of sweating, overheating, and then even chills. So some things you can do besides cutting things out or stopping hormonal therapy and then reintroducing it is things like biofeedback and meditation and mindfulness. Those things can actually help some people, not everybody, but some people can find that they can sort of work their way through hot flashes. Cognitive behavioral therapy can help without medications. You know, there are some things that can be done. It is often the case, though, that medications need to be introduced just to help you get through this particular side effect, especially if it's interfering with sleep. So that would be something you want to talk about with your medical team, medical treatments other than these lifestyle adjustments. If you're living with hot flashes, you've tried all these things and you don't want to go on medications, there's some other tips that can be helpful. Some people carry a handheld fan with them, and at the beginning, the immediate time they start to feel a hot flash or flush coming on, they can turn on a little fan. Those can be quite subtle, pretty small. Some people will fan themselves, but that can bring a lot of attention to you, and some people really don't want that. You can dress in layers, so don't wear a heavy sweater without something lighter on underneath. And then at nighttime especially, wearing a particular type of nightgown or pajamas can help. You can go online and find pajamas or nighties that can help with hot flashes. it's generally recommended that you do wear something, because if you sweat so much you have to change the sheets, that's so much more disruptive than just changing your nightgown or your pajamas. Now, all these tips are things I've learned from people going through this. This is not just pulled out of thin air. People are so generous with what's helped them. If you have something else that's helped you, drop it below in the comments. You can ask us questions. We try to get back to you within 1 to 2 weeks. We get back to you just as soon as we can. Don't forget to subscribe, and don't forget to go to yerbba.com to get your personalized report. Thanks so much for watching.